Hi, Dr. Brohenna here of AskTheDentist.com. Today we're going to talk about a question I get a lot on, and that is electric toothbrushes. Which one should I use? And unfortunately, even among dentists, there's some confusion. We get bombarded with clinical studies that promise and show us scientifically, based on all sorts of data, that this is the best toothbrush. And all the studies on the two different categories are very convincing. The two different categories I'm talking about are essentially Oral-B Braun and Sonicare, now owned by Philips. Oral-B Braun was the first one to come to market with a good electric toothbrush. It's a rotary head, very high quality head. It oscillates at about 30 degrees back and forth, and some of them pulsate a little bit. So this is a great scrubber. It's safe if used properly, and it removes the pellicle and the skin of the tooth very, very effectively. Then came along the Sonicare, and this essentially, using sound waves, sonic, not ultrasonic, sonic, 30,000 cycles per minute, it scrubs the teeth using sound waves, and its big strength is getting in between the gums and removing plaque that you can't quite reach, because the theory is that the sonic waves reach out and there's some action and some efficacy beyond the bristles. So which one do you use? Good question. I use both. I'm hoping that the overlap between the two strengths of the toothbrushes will help. So this, I typically, if you were going to buy one, I recommend this to patients under age 40. Also for children. This toothbrush, because of the way it feels initially, is a little alarming to kids because of that sonic wave effect. And this is easier for kids. It's also easier for adults to use this, parents to use this on their children. So under age 40, great for removing the pellicle, great for removing stains. This is for people that maybe don't floss as much as they should. They're a little older, over age 40. They have some gum recession. Food's getting caught in between the teeth. It tends to dive in there a little bit better. It's a little bit more maneuverable. Ideally, you should use both, and I would recommend that. But there you have the two different categories and who should be using which toothbrush. I hope that helps. Thanks for listening.